The driver faces prosecution. The BBC has learned that a patient died on an overcrowded ward in Stafford Hospital 6 years after a doctor warned of the dangers. He was later suspended. The medical union, the BMA, is now calling for a full public inquiry into how people speaking out against problems in the NHS are protected. Here's our health correspondent, Michele Paduano.
Ron Street knows Stafford Hospital caused his friend's death. A health and safety prosecution proved it. Jill Asprey, a diabetic, wasn't given insulin. Part of the reason for that failure was that Jill was an extra patient on a ward.
Fair to say they were extra beds annexed to a ward, but in a place that the ward actually couldn't see.
Correct. That's it precisely. There were 4 beds in there. 2 beds belonged to Ward 7, 2 beds to the trauma ward.
We took Ron Street's experience to consultant Dr Raj Mattu to get his views on what happened.
Like stunned and hugely disappointed to hear what was described. The National Health Service management continued to ignore serious concerns we had been raising in Coventry about how this compromised patient dignity, patient safety, and was associated with deaths.
What's the common theme that connects these 2 men? Well, Dr Raj Mattu, a heart specialist, blew the whistle on deaths from overcrowding in Coventry in 2001. Frozen out, suspended, his health ruined. It was only this year that he was finally vindicated following a tribunal. 50 miles away, Ron Street's friend, Jill Asprey, was an extra patient attached to a ward at Stafford Hospital. She died neglected at the height of the scandal in 2007. So why weren't Dr Raj Mattu's earlier warnings listened to?
I think it's absolutely disgusting, inexcusable, when they are trying to lead us to believe that circumstances had changed.
The chairman of the Stafford Public Inquiry, Sir Robert Francis, is to investigate the treatment of whistleblowers in the NHS, but doctors say there needs to be a full public inquiry. The Department of Health accepts those who speak out must be protected and listened to.
We may never have needed the Francis report because they could have fixed the problems and addressed these very serious concerns.
So could this man's heartache have been avoided if people had listened?
Michele's here now. Is this overcrowding still going on?
Well, no, not in the way that it was going on either in 2001 or in 2007, but I often think of the NHS like a balloon where if you squeeze in one place you get a bulge elsewhere, and at that time the bulge was at the end, actually on the hospital wards. They've actually tried stopping people coming into hospital, keeping them on ambulances. That's now been stopped as well. So the place where you find the bulge in the NHS at the moment is in the corridors in accident and emergency, trying to get into the system.
And what are the NHS saying now about people who want to speak out and how they should be protected?
The Department of Health says it wants to encourage people. It's set up a whistleblowing hotline for people to do so, and people must be listened to when they do that. Now, this review by Sir Robert Francis, though, is brought in because he's still getting people saying that they are frightened to speak out, and there was a feeling that they needed to do something about this. Now, the BMA have said actually it's not enough, it's window dressing, more needs to be done. The big issue, though, really is about managerial accountability. Was anybody actually held responsible in 2001 in relation to Dr Mattu? Was anybody held responsible this year in relation to Dr Mattu? Was anybody held responsible in relation to Jill Asprey? And doctors and nurses aren't going to feel happy until they feel that they are in the same position.
OK, Michele, thank you.